Learning Plan 6, the respiratory system and respiratory drugs. The respiratory system is divided into two categories, the upper respiratory, starting about the trachea up, and the lower respiratory, the trachea into the lungs. Different diseases affect different areas, and different medications are obviously used for the different diseases. We're going to break this discussion into first the upper respiratory illnesses and those treatments, and then the lower respiratory illnesses and those treatments. Each of these lectures will be relatively short because I'm focusing on a specific type of drugs in each one of these, just to make it easier for you to study and restudy in the future. When we talk about the upper respiratory illnesses, the most common is the common cold. It's almost always caused by a virus, a rhinovirus or an influenza virus. And the common cold is not influenza, but it can be caused by the influenza virus. This happens when the viruses invade the mucosa of the upper respiratory tract, the nose, the back of the throat, the sinuses, and this causes that upper respiratory infection. Excessive mucus production results from the inflammatory response, and this is the body's first defense to try and block that virus from getting any further. It creates that massive mucus buildup as a physical barrier. That fluid, though, is sometimes very excessive, and that can drip back into the pharynx, into the esophagus, and the lower respiratory tract. If you've ever had a cold and woken up with a sore throat, commonly that's that excessive mucus is just irritating the throat, causing that sore throat. It can also cause coughing and an upset stomach. Children commonly get nausea and vomiting from that nasal secretions draining into their throat and their stomach. Just because they're vomiting does not mean they necessarily have a gastrointestinal illness. It could just be the nasal secretions. When we get the common cold, the irritation of the nasal mucosa also can trigger the sneeze reflex. So the mucosal irritation releases inflammatory and vasoactive substances which dilate the small blood vessels in the nasal sinuses, which cause nasal congestion. If you've ever had a sinus infection, you know what I'm going to be talking about. Sinus infection, the sinuses up in our maxillary bones, up here in our frontal bones. The inflammation causes mucus buildup, causes pressure inside the sinuses, and we get this pressure in our forehead and in our upper cheek, and our teeth can hurt. That's generally just a common cold. No antibiotics are needed. We just need to clear that cold out of our system. We treat a cold empirically, meaning we treat the symptoms. We cannot cure a common cold. There is nothing to kill the virus that's invading us. We can only treat the symptoms and mitigate those problems and wait it out. Rule of thumb is, the old saying, it's rule of thumb, if you treat a common cold, you will get rid of it in a week to 10 days. If you don't treat a common cold, you'll get rid of it in a week to 10 days. Meaning it's going to last, but we can sometimes control the symptoms, which make us so miserable when we have a common cold. Some people take herbal and dietary supplements, commonly vitamin C, echinacea, and golden seal. Do they help? If you think they're going to help, they're going to help you. If you think they're not going to help you, they probably won't help you. But either way, the virus won't go away for a week to 10 days. So basically what we're trying to do is minimize our misery and control some of the symptoms. We're still going to be infectious, but this is an illness that is short-acting, self-limiting, and then it just goes away. There's no immunizations for it, unfortunately. There are over-the-counter medications you can use. Robitussin and the generic forms of that are a combination of medications. We have a cough suppressant, an expectorant, and a nasal decongestant in various combinations. People assume that because they're over-the-counter that they're safe, and properly used, they are safe. Improperly used, they can be dangerous. They can also combine with other illnesses and conditions to cause major problems. If you have high blood pressure, heart disease, thyroid disease, if you're diabetic, or if you have a chronic cough, these medications can actually do more harm than good. So that's a discussion of the simple upper respiratory illnesses. But let's talk about some of the more specific treatments. Specifically, we're going to talk about antihistamines, decongestants, and then expectorants and antitussives. So let's come back for part B, and we're going to talk about antihistamines.